Bismillah Rahman Rahim. This is Dr. Waqar. Today I will talk about history taking station MRCPCH Clinical Exam. In previous video I told you about the 4 minutes format, 4 minutes outside station. These 4 minutes are very important and you have to use these 4 minutes properly so that you don't lose the marks. So other thing in the history taking station, mainly candidates do mistake like unorganized history taking. They will have the remarks from the examiner. Unorganized means they are not taking history in organized way, and usually the other thing they focus on the one thing. So there are two things. For example, if you have a scenario with a joint pain, chronic joint pain, and in your mind that this is the juvenile idiopathic arthritis, JIA, so your history would be focused to the JIA. You will not look other things. So either you will take the history from the role player, all the associated symptoms, all things from the JIA. You will leave the other things, and at the end, last 3 minutes or last few minutes, you recognize that this is not JIA, this is SLE. So you lose all your time. You lost the time. For example, now at 10 minutes or 11 minutes, you find that this is a SLE. So how to tackle these issues in history taking station? And you should have to be organized. I will let you know how to be an organized history taking station. So as I told you previously about the format 4 P's. So 4 P, the first P is the present history. This is very important. Presenting history is very important. If you this is, if you have a art, the history taking is the art actually. So if you have a art to take the history properly, you will not lose anything and you will come up the diagnosis and differential diagnosis, so you will not miss anything. So make yourself to ask each and everything, even though you know the diagnosis and all symptoms or things are particular that diagnosis, definitely you will ask everything from that, but you should have to ask other things as well. So this is the short form. You can make any short form as you like, but this is the commonly students use DRCCR. So D for describe. So for example, today I am example is HSP, Henoch-Scoliosis purpura with joint pain. This is your history. So you will ask from after introduction, after repo, and after taking permission that I will write some notes while I'm taking the history. So you will have to introduce yourself, you have to make the repo, you will tell the mother or whoever is the role player, you will tell them that I am Dr. Waqar, one of the child doctor, and I came to know how are you today, definitely introduction, and then you will make the how today, and after that, whatever history has been given to you, you tell I came to know that your child, or whatever the name of the child, you should call by the name. So for example, it's Ali. So Ali is suffering from the joint pain, can you tell me more about it? This is a description, right? So let the role player tell you whatever she or he wants to tell you. Okay, so this is the description of the presenting illness. So now you know from outside the child might has the abdominal pain and joint pain. Okay, there are two symptoms, so each and every symptoms you have to take the separate history. For example, if a child has the fever, so fever, you have to ask questions for the fever. And if child has a cough, you have to ask question for the cough. For example, difficulty of breathing, sputum, and aggravating factor, relieving factor, does it affect his sleep or her sleep? So these things you should have to come up in the history. So after description, you will go to the associated symptoms, which is our related symptoms. So in HSP, definitely you will ask about the joint, you will ask about the GIT, abdominal pain, any bleeding in the poo, any vomiting, And also you will ask about like skin rash, and skin rash, the site size, itchy, non-itchy, increasing, decreasing. Then you will have to ask about the joint pain. So all these things, associated symptoms, you have to ask from each and every system, according to the whatever they gave you, whatever come up in your mind. So after that, concern, what are their main concerns? Sometimes their concerns are social. For example, child is unable to play football and he loves to play football. So these are the concern. For example, they have some financial concern. For example, mother has concerns of behavior. So sometimes other than the medical concern. So you should have to ask the concern. And when you are describing with the examiner, when you are telling, summarize your findings, main concern of the mother, you should have to tell the examiner. Okay, do not let the examiner to prompt you, but you should write in your notes, and main concern you have to tell to the examiner. Any chronic illness, any chronic condition, this is very important. Then review of systems, this is the thing which mainly candidates they forget. So they are thinking that they are asking systems which are related to the symptoms, but they don't ask the other systems. So how to ask, how to review these systems? So review systems should be head to toe examination, like we do the head to toe examination. Also, you should have to ask the history from head to toe. So head to toe means CNS. CNS, you should have to ask about the headache, ask about the dizziness, ask about the any abnormal movements, means seizures. You should have to ask about balance. So this is from the CNS side. Okay, and then you will go for the ENT, hearing, any problem in the hearing. Okay, and also if there is a related history, for example, you have the cough and patient is having asthma, you should have to ask about the allergic rhinitis, history of runny nose, chronic runny nose. Okay, any hearing implant, any hearing aid, hearing impairment. With this ENT, you should ask about, here it is a typo mistake, you should ask about the vision as well. Okay, so from CNS, head, then ENT, then vision. Is there any visual issues? So he is wearing or she is wearing corrective glasses or not? So after that, the vision. And then the neck, thyroid swelling. With the thyroid swelling, if you will ask about the bump and lump in the body, for example, swelling in any swelling or the bump in any part of the body. So this would be the lymph nodes. Okay, any swelling in front of neck. These are the thyroid swelling. This is the thyroid swelling. So this, with this swelling, also lymph nodes you can cover it. Then the chest, in the chest there are two things, the respiratory and the CVS. Respiratory, is there any difficulty of breathing? If yes, if any symptoms, for example, in CNS, you find that child has epilepsy, he has a seizure, so you should have to dig more about it. When did it start? What medication he's taking? What investigation has been done so far? Investigation, even at the end, you will ask. There is the other column, but you should have to ask about the more details if you find any abnormality in the system. So the chest, for cough, any difficulty of breathing and chest pain, and in CVS, any heart racing. Okay, for example, that if child is having a feeling of heart race, is means palpitation, chest pain. So these things you should have asked from the CVS. And GIT, any history of throwing up, means vomiting, poo means stool. And also you here you should have to ask about the kidney. For example, the pee, is there any problem in his pee, blood in the pee? Directly you can ask, is there any blood in the pee, red color pee or cola color pee, if there is any concern. Okay, and has anyone checked his blood pressure? So this comes also in the renal symptoms. Okay, after that, in gastro and kidney, then you will go for the MSK. And if you have a joint pain, how many joint pain, when it is start, onset, course, and then duration, any aggravating factor, relieving factor, does it impact his activity? So all these questions you should have to ask from the joint pain. And then skin is very important. And if you have a joint pain and you kept in your mind that this could be a JIA, and when you ask the question from the skin and you find that this is not JIA because the rays which are suggestive of HSP, so it is a HSP. So it is very important that you will go all system one by one so that you will not miss anything. So you will not miss anything in the history and you can save your marks. So skin is very important. You will ask about the any race. Then if there is a race, then history of race, for example, size, site, itchy, non-itchy, aggravating, relieving factor. So all these things you should have to ask in the systemic review, which is head to toe history, right? So this is the history. This is the art of history, as I am telling you. uh, for example, many candidates they go through with this organization, but they forget. For example, if mother has told that my child has a joint pain and already you took the history from the joint pain, you ask about the other joints, and so it's not necessary you will go the joint again in this systemic review. So you should have to be present there and make your reflexes fine, so that if you have asked anything in your presenting history, for example, you have asked about the if presenting complaint was the cough, right? So you should have to ask the cough, everything about the cough initially, then you will not come up in the systemic review respiratory system. So already whatever you have asked, don't come ask again those questions, because role player will be irritated with these things. So before I go forward, please subscribe and my channel for the further videos. I will upload the other videos as well, not about history, about the communication. So past history. In past history, this is the mnemonic 4T and IOA. So 4T means 1, 2, 3. So for 4T, usually it is a 3T. Okay, so these T's will have some mnemonic. For example, the one T is the treatment, which is missed here. Okay, so trauma, you will ask about the history of trauma. This is the past history. So if you will ask in this way, you will not miss anything. History of travel, which is very important history, don't forget. Any team he is following means multidisciplinary management. If any chronic case, they are already following with the MDT, so you should have to ask the MDT. If yes, then you will ask. For example, if trauma, you will go in detail little bit about the trauma, what how it happened, and what management has been done. Travel history, recent or very past. If recent travel, where, and if it is in the countries where there is a malaria or any other communicable things, did they take the vaccine or not? Okay, then the team of the doctors, what team, for example, if a patient is having asthma, so are they following with the pulmonologist or not? So these things are important. Then the treatment. Fourth one is the treatment. So 4T: trauma, travel, and team. So this and treatment. Trauma, travel, team, and treatment. So these things you should have to ask what treatment he or she is getting. So this is also important. Then the investigation, what investigation has been done so far? For example, if case of epilepsy, any scan, any EEG. If case of asthma, any lung function test has been done or not. And peak flow diary, all these things you should have to ask. If it is a case of, for example, I told you the example is HSP, then the urine dipstick done, and blood pressure, even has checked the blood pressure, any baseline workup has been done or not, and any operation, any surgery. If yes, you will go in detail. If not, no need to go in detail. If yes, the what kind of surgery has been done and how recent it was. Hospital admission. So duration of hospital admission, ICU, or in the general ward, or in the high, and what was the reason was hospital admission, and most recent admission, and longest duration of admission. So these things you should have to ask. These are 2 to 3 questions. If there is admission, 3 questions. If there is no admission, only 1 question. You will ask closed question, yes or no. Okay, there are one open-ended question and the closed question. So open-ended question, the role player will give you is reply in a statement like would you please describe for me. So this is the open-ended question, so role player give you reply in a sentence, in a statement, right? But a close-ended question, it is yes or no. So you should have to manage your time. If you think that you have very short time and you spend a long time on the other things, then go for the close-ended questions to complete the history. So this you should have to keep in the mind. Okay, so this was about little bit about the history. The other thing, which is the previous slide, it was 4th P about the perinatal history. So in perinatal history, there are 3 things. So before birth, during birth, and after birth, right? So perinatal, natal, and postnatal. So perinatal history, in perinatal, you will ask about the pregnancy. How was your pregnancy? Was it went smooth? Was it went smooth or not? Any scan done? And anomaly scan usually they do at the 20 or 21st week of pregnancy. And his mother is taking any medication. So this is very important because the teratogenic medications, they can affect the child development. So especially the antiepileptic or antihypertensive, his mother is diabetic. If it is yes, then weight of the child and any abnormality or any growth problem to the child, growth retardation to the child, you will go for a more detail. The natal history 40, the term is baby is born on time or not, means 37 weeker or before. Was he born normal delivery or with operation? Did he cry immediately? And did they put on did he cry immediately or not? And then birth weight. So this is the natal. Then postnatal history, you will ask about the did they discharge you at the on same day? Did they put on the breathing machine? That means child has in the breathing machine, means or he was he admitted in the baby unit? If yes, go in detail. How many days? How many weeks? Then what he received? What investigation has been done so far? So any history you will get the positive history. Anytime you will get the positive history, you will go in detail, right? It's not like that mother is telling you that my child is born 1 month before of his birth time, and then you should have to ask more about it. All right. And after birth, was he admitted in the baby unit? If yes, what they did they give any antibiotic? Because if he received any antibiotic and he got any infection, or he was he was ventilated, definitely he must have the growth problem. So because of this, you have to ask the other questions of the hearing, especially did he receive any gentamicin, anything, or he is having HIE. So these are the things you should have to dig in the history, and if you have anything positive, you have to tell the examiner about the positive findings of your history. Okay, so there are a lot of time with the examiner, like it's around 10 minutes. So 2 minutes for your summarization. Usually candidates summarize within 30 seconds. They summarize in 2 3 lines. Some candidates, they will take maybe 3 4 minutes. So better to be summarized in during these 2 minutes time, whatever time has been given to you. So summarization is also something which you should have to learn. And after summarization, definitely examiner will go for the your most likely diagnosis, differential diagnosis. So differential diagnosis, mostly candidates are telling 1 or 2, and they are thinking, I told the diagnosis, this is a perfect diagnosis, I'm very sure. And different diagnosis, maybe they tell 1 or 2. So in history station especially, examiners they want the differential diagnosis should be 5 10, some examiners even more. So they need the differential diagnosis. They will see that candidate is thinking other things as well. So they examiner know what is the diagnosis, but examiner wants to see in you that are you are capable to think other things as well, or you are capable to rule out other things from your history, whatever history you have been taken. And you, for example, if it is a joint pain, why it is HSP, why not JIA, why not osteomyelitis, why not septic arthritis? So this is the thing examiner will see. Are you telling the differential diagnosis if it is acute history, the acute differential diagnosis. If it is chronic history, then you are giving about the chronic differential diagnosis. And are you able to rule out the causes which are not related with your history? Are you able to rule out causes from the history? So these things are important in history taking, and this is the art and the practice. As much as you do the practice, you will have a good grip on the history, and you can get a full marks. Thank you very much.